Hello everyone, welcome to our next topic for our overseas viva or interview for general dentistry preparation. This is just an overview of this particular topic. We are not looking into it detailedly like we do for our undergraduate or postgraduate preparations. Define rampant caries. According to Masler, 1945, rampant caries is defined as suddenly appearing, widespread, rapidly burrowing type of caries resulting in early involvement of pulp affecting those teeth that are usually regarded as immune to ordinary decay. What are the other terms to describe rampant caries, nursing bottle syndrome, baby bottle tooth decay to early childhood caries, MDSMD, that is maternally derived streptococcus needles disease. It would be great if we can learn early childhood caries while we are learning regarding rampant caries, because there are a lot of similarities and differences between rampant caries and early childhood caries. We will make a separate video and a slide for the difference between rampant caries and early childhood caries, and a couple of more points on nursing bottle caries. The etiology, usually due to poor oral hygiene and taking frequent cariogenic snacks and sweet drinks between meals. Patient ignorance. Emotional disturbances may be a causative factor in some causes of rampant caries. Emotional disturbance may initiate an unusual craving for sweets or develop the habit of snacking, which might result in dental caries. So we as dental care professional must encourage our patients to take good oral hygiene at home, and also training our adult patients to teach their children at home to maintain a good oral hygiene, how to brush, good tooth brushing technique, and devices. They should be introduced to the available devices and dentifrices that's available for them to use at home, and as well as to seek dental care when it is required. Additional factors, saliva. So in some patients, due to their saliva consistency also, it could be a factor resulting in rampant caries. If a patient has a salivary deficiency due to any cause, that is also at higher risk of dental caries. Any cause means like radiation due to any form of cancer, part of a cancer treatment, or due to any syndrome, xerostomia, or any form of condition, also be a factor to result in rampant caries. So evident reduction or complete absence of saliva results in an acidic environment favorable for caries activity like rampant caries. Anatomic features of teeth, when there are already other factors in risk factors. Now even the anatomic features like fissures or deep grooves could be a adding factor to the rampant caries activity. Socioeconomic status, when they don't have enough money to invest into oral hygiene aids or even to seek a dental care from a dental clinic, that could be another adding a factor to rampant caries. Now the clinical features, we can look at primary and permanent dentition, because both are based on the sequence of tooth eruption. In primary dentition, the initial lesions appear on labial surface of maxillary incisors near the gingival margin as white area or pitting on enamel surface, whereas in permanent teeth, similar to primary dentition, it is based on the order of tooth eruption. Buccal and lingual surface of premolar and molar are involved. Proximal and labial surface of maxillary incisors and proximal surface of mandibular incisors are involved. So in primary, initial lesions appear on the labial surface of maxillary incisors near the gingival margin as a white area pitting on the enamel surface, whereas in the permanent, buccal and lingual surface of premolar and molar are involved, and proximal and labial surface of maxillary incisors, maxillary, proximal and labial surface, whereas in mandibular incisors, proximal surface of mandibular incisor are involved. These clinical features are based on the studies and a lot of analysis. Now the caries prevention is a very important part of our dental care. As dental care professionals, we should encourage our patients on these. So that is one is tooth strengthening or protection is our main goal. And second thing is a reduction the availability of the microbial substrate, removal of plaque by physical or chemical means, and these can be achieved, these three approaches can be achieved by dietary advice, fluoride, either community water fluoridation or even professional fluoride application, then fissure sealing and regular toothbrushing. So dietary advice, I'll give an example. You can encourage your patient to watch out on their as in diet, like to increase on fiber containing meals and to reduce on their in between meal snacking and sugary drinks and acidic drinks, because acid can cause erosion, you know. And even in fact encouraging the patients on pre-eruptive and post-eruptive care, because in both phase of children, pre-eruption and post-eruption, fluoride is important. Pre-eruptively, calciums, vitamins, phosphates are very important, and post-eruptively as well, but sugar is also an important factor. In pre-eruptively, to watch out the consumption, and post-eruptive to really reduce probably on the consumption of sugar, and to increase fiber and starchy foods and fresh fruits and vegetables. This will in fact improve their overall health. And fluoride application is also another important, especially pre-eruptively, enamel formed in the presence of fluoride has improved crystallinity, increased crystal size and decreased acid solubility, and more rounded cast fissure pattern. But so that could be just an additional prevention. And and one more thing we have to remember is that newly erupted teeth derive the most benefit from this topical fluoride application. So an increased concentration of fluoride inhibits the plaque and the synthesis of extracellular polysaccharide. So that what happens is that a drop in pH releases free ionic fluoride, which augments these actions. So fluoride is more effective in reducing smooth surface than pit and fissure caries. So it's just like a shield. So this was just to know what are the means that we can employ in order to prevent caries. Now management of rampant caries, it will be almost similar for our early childhood caries as well. That is, arrest and control active caries process. All caries lesions should be excavated and restored. Sealing of all pits and fissures, pit and fissure sealants. Okay, home and professional fluoride treatment, oral hygiene instructions like we mentioned earlier. Okay, and in early childhood caries, we do have some more management, which we'll be talking in one of our next video. Thank you. All the best.